Dr. Darlene Weyer is with us. She's from the Hope Garden out at Lima Memorial. We're talking about the Breast Cancer Awareness Month. She is the medical director of Lima Memorial's Women's Health Center. First of all, let's talk about screenings. I know obviously you've been a big proponent of that and trying to get that word out. First of all, tell us why that's so important. Why are these screenings so important to our lives?
Screening mammograms are so important because it allows us to pick up breast cancers when they're very small, sometimes not even being able to be felt. And the sooner we can pick up the breast cancer, the better it is to treat the patient and the better chance she has at surviving breast cancer.
Give us the guidelines. Sometimes I think over the years they get tweaked a little bit as far as who should get screened and what age and that kind of thing. But tell us the latest, what we should know.
That is correct. There are different guidelines. So what we recommend is that patients get a baseline mammogram starting at the age of 35. And then starting at the age of 40, that the patient have a mammogram every single year. Because again, the sooner we can pick up the breast cancer, the better it is to treat it. What you don't want is to come in today and have your mammogram, and then your cancer starts tomorrow. And then if your cancer starts tomorrow and you wait 2 years, 3 years, 5 years to come and have your mammogram, it has the potential, and it will grow and potentially spread through the body.
I know you guys have really tried to ease fears too, especially during the pandemic, because so many people on various levels of ailments have put off screenings and they're scared to go to the doctor or the hospital because they're afraid of contracting the COVID. But you guys have worked really hard to make sure everything's sanitary and proper precautions are taken. Tell us about that a little bit and how you've worked on that.
That is correct. And we do have disinfecting protocols in place that we do after every single patient. Both our patients and our staff are masked. Everyone's still wearing masks. We social distance. And even though there is the coronavirus, what we're telling our patients is that, you know, you have to look at the risk and the benefits. There is the potential anywhere you go at contracting the coronavirus. I mean, you can get any disease really, no matter where you go if it's contagious. But you have to look at the risk and the benefits. And the fact that we do disinfect after every patient, we're masking, we're social distancing, we're doing everything that we potentially can do to decrease the potential of contracting the coronavirus. But the flip side is if you don't come in and have your mammogram and the cancer is missed, then you have an increased risk of dying from breast cancer. So I think that when you look at the pros and the cons and everything that is in place, everybody that has not had a mammogram in the last year that is 40 or older should call the imaging center and schedule their mammogram.
And you guys recently have increased accessibility to mammograms. Talk about that and what you did there.
Yes, we're very excited about that. We have been doing mammograms out here at the Medical Park on East Town Road for 21 years, and now we are very fortunate in that we were able to open a second satellite center. It's in Wapak. And so what patients can do is they can call that same phone number, 419-998-4497, to schedule their mammogram. And then they can let the staff know where they would rather have their mammogram and which facility is closer to them.
Very easy to do. As you said, that's the first step then. Just call that number and get it set up, right?
That is correct, Jeff.
All right, excellent. From the Hope Garden, thank you, Dr. Weyer. We appreciate it.
Thank you, Jeff. I appreciate it.
You bet. Nice seeing you. We'll be back right after this.